AM 1450, FM 99.3 KNSI. Welcome to another edition of Your Health. Dr. Jill Amsberry is a pediatrician with CentraCare. Dr. Amsberry, welcome.
Thank you. Thanks for having me.
We are here today to talk about seasonal allergies, and it is one of those things that once you have them, boy, do you know, right?
That's right.
Now, we're going to talk about the changing seasons, some of the triggers that happen, some of the home remedies, and, of course, allergies, diagnoses, and the treatment of the same thing. But where would you like to begin? With the changing of the seasons, it is springtime. Things are going to be busting out all over, aren't they?
That's right. Yeah, this is the time when we start to see that transition from viral illnesses to allergies, where things can kind of become a little confusing about what's a virus and what are allergies.
Yeah, well, how do we know if I have a simple cold or if I'm just, maybe flu is lingering or what?
Yeah, you don't always know, which is why if you're not sure, it's a good idea to go see your primary care provider for more information. Typically, allergies are going to look a little different. You're not going to see a fever with allergies. Right. You're going to be more likely to see, itchiness, watery eyes, itchy nose, runny nose, and not as much of the just thick congestion and body aches and fevers to go along with it.
Any coughing going on with this stuff?
Cough can go along with it, particularly if you have postnasal drip with it. So that can make it a little bit more confusing. Or people with asthma whose allergies get worse this time of year. Right,
and that's a pretty serious illness, asthma, when it comes time for these allergies. What happens with asthmatics and allergies?
That's right. So we don't exactly know. I think the mechanism is still not entirely clear, but we do know that people with asthma are more likely to have allergies, and people with allergies are more likely to have asthma. So when they get this allergic response, histamine builds up in the system, and that triggers their the tubes within their lungs to kind of constrict down, so it makes their asthma worse.
Right. Now, you have asthma?
I do.
Right? What typically bothers you in the springtime in Minnesota?
Yeah, so some of the blooming flowers bother me in the springtime. I have allergies to trees and grass. So springtime, that's a common time that you're going to see tree and grass pollens out and bothering anyone with allergies, but particularly those who have asthma.
Well, how are you doing this year? Is business picking up at CentraCare? Are you dealing with a lot of allergies this early in the season?
So far, so good. I think the snow has kind of kept things at bay for a little while.
Now, let's do a little comparison here. Last year at this time, I think we had a very early allergy season, did we not?
Yes, we did.
And again, that was lack of snow cover?
That's right.
Okay. So the snow comes down, covers everything up. It's really nice, right? Snow goes away. What are they called allergens or pathogens that we have to worry about?
We usually, they're a bit like pathogens in that your body thinks that there's something that is foreign to it. Okay. But I would say they're more like allergens, pollen, that your body's reacting to.
So why? What happens? What causes this allergic reaction?
Yeah. So our body is really good at trying to identify foreign things. Okay. That's how we stay healthy. So that's when we see a virus. That's why we get, fevers and sickness from it, as we're trying to get rid of those foreign pathogens. Okay. With allergies, or people who have allergies, some of the outdoor pollens our body thinks are pathogens. And
they think that the body's being attacked.
That's right.
Okay.
Yep. So it mounts an immune response and develops antibodies against those things. Okay. So then every year when you're re-exposed to those same pollens, your body mounts an immune response. And that's what that's what makes that stuffy nose, runny nose, watery eyes.
So if these allergens or pathogens, whatever, if they hung around all year, 24/7, 365, would our body develop a natural immunity to these things?
That's a great question. I think there is some evidence that says that for a lot of people that could be the case. We use that mechanism to treat some really bad allergies, where we do immunotherapy or injections of those antigens, pathogens, pollens, and we sort of trick our body into becoming desensitized to it. So there is some evidence that shows that if you did see it all year round, that you might not have as big of a reaction.
What about, let's say I grew up in Southwest Minnesota, because I did. Never had allergies as a kid growing up. Never had a problem on a farm, right? You'd think it'd be just crazy. Moved to Bismarck, North Dakota in 2003, and I was allergic to things in Bismarck that I had not been allergic to in Minnesota. Is it a regional thing? Can it be?
That's a great question. A lot of people will say that.
Yeah.
So, even for myself, when I moved to Arizona, I felt like I didn't have asthma or allergies anymore. Right. And then I moved back here and symptoms got a lot worse. The research hasn't necessarily shown that to be the case, although we do know that certain climates, can produce different types of pollen. Right. So,
well, and perfect case would be if you're ever vacationing in the Gulf of Mexico and the red tide comes in. Right. It doesn't matter if you are allergic to it or not. You're going to get an awful lot of respiratory problems from that. Are there other allergens, pathogens, if you will, that really everybody is going to be susceptible to?
Yeah, I mean, the biggest ones will be those that are the most common all across the U.S., and those are trees, grass, and ragweed. Okay. And ragweed grows everywhere.
Right, and right now, what's out there?
At the moment, what you're going to see, so in the springtime, you're going to see mainly tree grass. Okay. And then in the fall, you'll start to see more of the ragweed coming.
And what's really fun about allergies is that all the trees should blossom at the same time. We should get them to all bloom at this, like 1 week.
Right.
But that never happens because one starts, it ends, the next one starts, and then comes grass. Oh, yeah, and then come the birch trees, the last one to ever leaf out and all of that. And by then, it's like towards the end of May.
Right.
So we've been suffering for a long time.
Right. That's why it's important that if you have allergies and you know that you're allergic to certain things like tree grass, to start your treatment sooner rather than later.
All right. Very good. Dr. Jill Amsberry is our guest. She's a pediatrician with CentraCare. We are talking about seasonal allergies, my friends. We will continue that conversation. You're listening to Your Health on KNSI. AM 1450, FM 99.3 KNSI. Welcome back to Your Health. Oh, we're talking about allergies and things that we can do to feel much better. Dr. Jill Amsberry is our guest. She's a pediatrician at CentraCare. Dr. Amsberry, we were talking about trees, all sorts of grasses and that sort of stuff, outdoor allergies, but what about indoor allergies? Because, cats and dogs are inside, right? There's a lot of other stuff, isn't there?
Yeah, that's right. Yeah. So cat and dog allergies are similar to the seasonal allergies that we see. Response is similar. The way that our body responds is similar. It's different in that the cat and dog is with you all the time. All the time, right. Yeah.
Well, what about things like I just had new carpet installed? Right? And it's bothering my throat. It's bugging my eyes. There's a lot of synthetic things that people can be allergic to.
That's right. A lot of people can be allergic to chemical allergies. Other things that can happen if you've had carpet removal is, if it's a home that someone else has lived in, there could be animal dander in there. Right. Dust is another common indoor allergy that we'll see.
Now, you mentioned dander. From pets, right? It's not actually the hair on the animal, the fur on the animal, is it?
That's right.
Okay, so where is that dander in the critter? Is it off the skin?
Yeah, it lives off the skin. Okay. Yeah, so even hairless animals can produce dander that you can mount an allergic response to.
Well, everybody has to have a cat or a dog when they're growing up. We? And what about other animals like guinea pigs or anything like that? Yeah. Mice, are there is there dander there too?
Absolutely. Yeah. People can react to any of those animals. Fish are a good one for people with allergies.
Absolutely. Right on. What about laundering those pets? Not putting them in the machine. I understand that, but making sure that they're nice and clean with shampoos and all that stuff. Can that help at all?
It helps. It brings down the dander for a short period of time, but it doesn't take away, that allergic response. It's still going to be there.
Okay, so it's not the animal, it's the people.
Right, exactly. About. Get rid of the people, I guess.
So, is there a particular age that people, because again, I did not have allergies as a child, but now that I'm older, I do.
Yeah. So, and a lot of people think that if they haven't had allergies as a child, that they can't develop allergies later on. But you really can develop an allergic response anytime throughout your life. The most common time is, around the ages of 5 to 10. So we see a lot of that in our practice. In Infants and really young children are less likely to develop allergies, and that's because they need time for their body to mount that immune response.
Sure.
So they haven't, particularly with seasonal allergies, they haven't seen those pollens enough times in order to develop the antibodies against it.
I'm trying to think, if there happens to be a first-time mom, right, and that baby, whatever, or child first is now they're getting old enough now to when they first have that allergic reaction. That's got to be kind of scary as a mom, huh?
Yeah, it certainly can be scary, and allergic reactions can present in a lot of different ways. Sometimes it's just a little runny nose that they can't figure out why it's not going away. Some kids will develop a rash, hives with it, and so it certainly can be scary.
Hey, what about things like bee stings, mosquito bites, or chiggers, or that kind of stuff? These bugs that are going to be wanting to eat us alive this summer. Are there certain people that, well, of course there are, that react to a bee sting? Those EpiPens save their lives, right?
That's right. Yeah. Bee stings in particular, we know that people can have anaphylaxis or that, real severe allergic response with bee stings. A lot of people think that their kids may be allergic to mosquito bites because kids actually can develop really big responses to a small mosquito bite. Yeah, even big swelling of their extremities. Mm-hmm. But the majority of the time, it's just a local reaction and not a true allergic response.
All right. Now, I love talking about home remedies, right? Particularly with mosquito bites. Oh, just take your thumb and put an X in there and it'll stop itching. Have you heard that one before?
Oh, yeah. Yep.
Does it work or is it in our head?
I think in some, to some degree, it works.
Yeah.
So I think it decreases the blood flow for a very short period of time.
And stops the itch, maybe?
Stops the itch for a very short period of time because most likely it's because different nerve sensors are being responded to, right? The pain sensors instead of the itch. But that one is one that I wouldn't use long term.
Right. I figured that the X wears off, but by then the kid's off playing again already and they've forgotten about it, right?
Right, exactly. If it makes them feel better, it's good.
Well, I can't wait to ask you this question. You said that you've heard them all of the home remedies. Let's share some of those home remedies that may or may not work. One of my favorites also is, if you just eat honey that's been produced locally, you won't have any allergies.
Yeah, that's really interesting. So honey is one that So no, that's not true. And in fact, people can develop oral allergy syndrome where they actually have numbness and tingling of their mouth from honey, particularly honey that's produced elsewhere. And so, no, honey is not the cure to all your allergies.
Okay, what are some of the other ones that people have brought into the doctor's office?
Yeah, I mean, there are many different types of oils out there that people feel like might be helpful. They've been, studied to some degree and have not found to be particularly helpful.
Okay.
There are people who will ingest certain dietary things,
supplements or what have you,
thinking that will change their allergic response or their, sensitivity. There are also people that believe blood type is a factor in
I'll be darned.
whether the mosquitoes, are
even
more attracted to you.
Sure,
Mm-hmm.
sure. Okay, so let's say, as a pediatrician, I'm sure you have treated many children that have stumbled into a patch of poison ivy, poison oak, or something like that, right?
Yeah.
Now, that can be really nasty for kids. I understand that. But bathing in things like baking soda or oatmeal, does that ease that itch a little bit?
Yeah, I mean, for some kids, that actually can be helpful. Okay. They feel like it's soothing. It's not a treatment, of course. The reaction has already happened. But it can be soothing for the kids to bathe in something like baking soda or oatmeal.
Dr. Jill Amsberry, and she's a pediatrician with CentraCare. We will take a break, and when we come back, we'll talk about symptoms. When is it time to go to the doctor? What about over-the-counter medicines? All these things that you can do. Is there such a thing as prevention? And how about those tests? We always used to see those markings on the back, right? The grid laid out. Dr. Jill Amsberry, our guest. You are listening to Your Health, AM 1450, FM 99.3, KNSI. AM 1450, FM 99.3, KNSI. Back with Dr. Jill Amsberry, pediatrician with CentraCare. Folks, we're talking about seasonal allergies. Well, Dr. Jill, what do you think? When do I know that it's time for me to ring up CentraCare and get an appointment with Dr. Jill Amsberry?
Yeah. So, of course, we're happy to see you anytime you have questions or concerns, and also can answer those questions or concerns over the phone or through my chart. But, typically what I say is if you're trying the over-the-counter products and you're not finding that they're helpful, or you feel like you're having a more severe reaction, that would be a time to contact your primary provider.
Okay, so the pharmacist is there, right? They really know that stuff, that over-the-counter stuff, don't they?
Yep, they do. Yep.
So ask your pharmacist, right?
Yeah.
And chances are good they're going to be able to suggest something that really will work. And if it does not, that's when we give you a buzz.
That's right.
Now, there must be, and I don't do any over-the-counter medications at all for allergies. I just suffer through them, and it seems to be okay. I do that because I think that there may be a time when I really may need that dose of Benadryl, if you will. Is that bad thinking, do you think?
No, not at all. I mean, I think if you feel like you can make it through without having too much difficulty with it, I think that's fine. Unfortunately, there are a lot of people who aren't able to do that, and then I think it's fine to take the medicines too. Okay,
now why do some people really get knocked on their keister from allergies, and other people, for example, myself, I can get through it. Not that much of a problem.
Yeah. We don't exactly know why some people react more than others. Certainly we know that allergies, asthma, eczema, that kind of triad of symptoms does tend to run in the family. Mm-hmm. So there may be a genetic component to why some people react more than others. But I don't think we have that answer yet.
Okay. What about the grid on the back, right? Isn't that where they usually start doing the allergy testing and all of that? Is that still the way it's done?
Or on the forearm is another common place that they'll do it. But yes.
Laying out the grid,
yeah,
right?
The skin testing is still the gold standard for allergy testing. Now, if you're looking for allergies, actually what's more important than that is the patient's history. So your history, what you've responded to, when you've responded to it, what kind of symptoms you developed are all a lot more important actually than the testing. The testing helps us confirm our suspicions, but isn't the most important piece of the puzzle.
What if my mom and my dad suffered with allergies? Is little Bobby going to be nailed with allergies too?
It's possible, but it doesn't mean you're definitely going to.
All right. Does it increase the odds?
It does.
Okay.
Yep, it certainly does.
So what are some of the things that we should be thinking about, keeping in mind if we find out that, you've tested positive for this, tested positive for that, but negative for this? Can we make some lifestyle changes that will I don't want to move across the country or anything like that, but are there some things that we can do to manage these symptoms?
Absolutely. And particularly when we're talking about seasonal allergies, that your time is coming. That allergic response is coming. So if you start your antihistamines or start your nasal steroids sooner before the season actually starts, you're going to be much less likely to develop a significant response. Other things that you can do within your house is just keeping your windows closed. It's nice in the spring to open those windows, but sometimes for allergy sufferers, that makes things a lot worse.
Well, in the height of the pollen season, look at what's on your car.
That's right.
Right? So leading up to the height of the pollen season, the particles are so much smaller. They can find their way through those screens. Not a problem at all. Also on your clothes, right? When you come in from being outside, what should we do? Yeah,
take a shower. Yep, go in. You can take a shower, keep those windows closed. Even when you're in your car, keep your car windows closed.
Are you a fan of air purifiers?
Yeah.
I would think in the worst, especially for a child, right? That's when I would think maybe trying to fire up that air filter with a HEPA filter in it.
Yeah, there's some good data about those filters, but there's variability in what you're buying. So you want to know, talk to your allergist, talk to your primary provider before you spend the money on one.
Exactly right. Some things that are always hard to deal with when we have this poor child, right, that is just suffering. Chances are good an over-the-counter medication will be able to help that child.
Right.
Right?
Yep.
Okay, what about us grown-ups? What should we be thinking about? Should we keep, a supply of Benadryl? Maybe we've got a bee sting. We don't have to worry about the full anaphylactic shock or anything like that. But is Benadryl a pretty good over-the-counter thing to have around the house?
It is. I mean, I carry Benadryl with me wherever I go because I have little kids, so I never know, what kind of reaction they may have. Benadryl wouldn't be my preferred medication for chronic use because it can cause sleepiness and has some side effects. So some of the other antihistamines that are of a different generation, similar to Benadryl, but a different generation, have less side effects and are
Okay.
better tolerated long term.
Now, I have no problem with you dropping name brand over-the-counter things that you would normally prescribe or suggest to a patient. So let's go right ahead. What works for example, grass and tree allergies that we're probably going to be afflicted with very soon, if not already?
Yeah, the interesting thing about antihistamines is what works for one person doesn't always work for another.
Really?
And so, we see that with Claritin. It seems like there's a subset of the population that really responds well to Claritin.
Okay.
Others maybe not. So there's, there are a lot of different non-sedating antihistamines over the counter. So Claritin, Allegra, Zyrtec, common ones that we'll see. Right. And really, if one's not working, it's always okay to try a different one.
Sure. How long does it take before you realize, this isn't going like it should?
Yeah, it depends on how far in you are to your symptoms.
Okay.
If you're in pretty far into your symptoms, it's going to be harder and it's going to take a little longer for that antihistamine to work. So I would say I would give it, a week or so on the antihistamine. If you're not noticing an improvement, then it's worthwhile to try something else.
But again, if you suffer from allergies, now would be a good time to talk with your pharmacist, get a good over-the-counter thing, and start experimenting. Always read and follow the label directions.
That's right. And the other thing that people forget about is many people suffer from the nasal stuffiness and runny nose. Yep. And using a nasal steroid, which are now over-the-counter, can improve a lot of symptoms as well.
Nasal steroid, just a little spray, like Afrin.
No, that's different actually. So Afrin has a different medication in it, and that would be not one that I would recommend using long term. It actually can cause complications if you're using it for more than just a couple days at a time. So Flonase or other inhaled or nasal corticosteroids, those, and you can check with your pharmacist if you have questions.
Right. Those pharmacists.
They're very helpful.
The bottom line of defense right there.
That's right.
Dr. Amsberry, thank you so much. Just say that you'll come back and visit us again.
Would love to.
All
Thank
right,
you.
Very good. Dr. Jill Amsberry, pediatrician with CentraCare. You have been listening to Your Health, AM 1450, FM 99.3, KNSI.